This is Dr. Carol Heinrich, and we're going to start Module 3 this week, and it's on gerontological assessment. Again, the assessment that we're going to be talking about in this class is a focused assessment. We are not going to do the complete physical assessment of an older adult during this module. Again, we're only going to be looking at the focused assessment for an older adult in relation to the atypical presentation of disease in this presentation. Again, the assessments could take place in any settings, long-term care settings, hospitals, homes, as well as even health fairs that are taking place in the community settings. The purpose of an assessment, again, these focused assessments, to maintain patients' functional abilities. We spoke last week about functional status is a key critical indicator of a patient's independence, and then again, the higher level of functional ability, the more independent the person is and the less of a chance for long-term care facility placement. Okay. We mentioned also last week that most older adults are living with a chronic disease. Again, if the chronic disease is effectively managed, they still stay on the health side of the health illness continuum. And again, as someone with multiple chronic diseases, if they're not effectively managed and they're not in their optimal level of health, complications can set in and their functional status is going to begin to decline. As a nurse caring for older adults and performing these assessments, you need to be able to understand and differentiate normal age-related findings from indicators of disease or disability. You need to know what's normal and what's a sign that disease may be setting in and further investigation is needed. Older adults often present with vague signs and symptoms such as loss of appetite, don't feel like eating anymore, I'm tired, I'm losing weight. Again, these are subtle signs and they are not signs of normal aging. So again, further investigation is warranted. We're going to focus on an atypical presentation of disease or illness in older adults. As a person ages, the physiological adaptation to a disease changes, and again, the person is going to present with different symptoms or may not even have any presenting symptoms, but the disease process is setting in on their body systems. You need to be able to pick up these subtle signs and figure out if an atypical presentation is occurring. Early recognition of a disease, such as a heart attack, is critical for the best optimal health outcomes for that person. Early diagnosis and treatment is critical. A very common atypical presentation that we see in all healthcare settings is cognitive impairment. This is delirium we're focusing in this session. Delirium is an acute confusional state. It happens quickly. Mental status changes and delirium sets in. It's differentiated from dementia, which is a chronic progressive type of confusion. So again, just as an example, over 60% of the hospitalized older adults with atypical presentation, delirium was their chief primary finding in their assessments. All right, with the atypical presentation of illness, it's very vague. They're subtle. They don't have the typical signs that are associated with certain diseases. Again, pain is one, as well as fever, which we mentioned earlier. So again, keep that in mind with GI pain as well as heart attack pain. These are just some examples of case reports that were found in the literature. Patients with documented acid-related diseases of the GI tract presented with no pain, or if there was pain, it was very subtle or vague. Again, same thing as for heart attack pains. Even with males and females and older adults, they present with vague, nonspecific symptoms. They may not have any shortness of breath, but they may have some confusion or they may not have confusion. We know from our work with coronary heart disease, women have different symptoms than men of any age, but again, older adult women make that disease harder to diagnose because of the absence of pain and the more subtle symptoms that occur in older adults. Cognitive changes, again, add to the difficulty of diagnosing diseases early, especially with the atypical presentation. Again, with cognitive limitations, a patient may not be able to express what he's actually feeling even at the time of disease. This is just an example of a case report of a 73-year-old man who had dementia, and he was having behavioral difficulties. And the behavioral difficulties were anxiety and agitation. But they were wrongly diagnosed as dementia. But again, as you read through the slide, it finds out that his behavioral problem was truly because of a pheochromocytoma, which is a tumor of the adrenal gland that secretes high levels of catecholamine, which would raise his blood pressure. They thought his blood pressure was a sign of the caused by the agitation and anxiety. But again, when they looked further, investigated into the problem, they found that it was not dementia, it was pheochromocytoma. It's very important to be able to recognize these atypical symptoms, especially for people over the age of 85, those with chronic illnesses and many medications. Their cognitive abilities and functional impairment is probably somewhat more limited than someone without the comorbidities. They're even more at greater risk for developing the atypical presentation. And again, they're harder to explain their symptoms or signs that they are having. So again, if you don't recognize atypical presentation, it is dangerous because the quality of healthcare is not going to take place. And again, delayed treatment requires longer hospitalizations and more complications can set in. So again, we often term this atypical presentation the geriatric syndromes. And again, you need to be able to identify these early and begin treatment in a timely fashion to have the best healthcare outcomes. We're going to be spending more time as we work through our way through the modules about the geriatric syndromes. So again, now it's up to you as a nurse, because often you're the person who does this first assessment. So again, it's a problem-focused history and a problem-focused physical exam, and then you're going to be going over and analyzing the data that you have obtained during your assessment and health history, and you're going to determine if an atypical presentation may or may not exist. Okay, here we're going to be doing your nursing assessment of an older person. These are common steps that you would be doing, not really that much different than from a person, a younger adult or a middle-aged adult. But again, temperature, lighting, keep fluids available, privacy is issue. Want to be near a bathroom in case they do have frequent urination. Okay, and again, you want to make sure your assessment is, you don't want to hurry the patient. You may have to be doing it in steps. You may not be able to do the whole thing at once. Give them plenty of time to answer questions. Silence works. Look for fatigue signs. And again, make sure you manage your time and the patient's time and be aware of decreasing energy levels. Then we're going to be talking about your problem-focused history. In the history, detection of the atypical presentation is critical. So again, you're trying to elicit questions from someone who may have some cognitive limitations, but again, be able to ask questions that you're going to be looking for more like confusion and lethargy and tiredness, some of the more subtle symptoms, rather than the classic chest pain or pain. Okay. You may want to include the caregivers or their significant other during your history questions. And again, if you can't get an accurate history, try looking at the medical record or talk to the primary care provider to get more historical detail. Then you're going to have to figure out, again, analyze your findings to see if any of these symptoms that this person is presenting with may be atypical presentation of either heart attack, infection, any of those commonly occurring disease processes in older adults. Again, it needs to be passed on to the provider for quick interventions if present. This is just an example, and I know you're going to have to do a health history as your written assignment for this module. This is just a format that you can use. Right, and again, you're just going to be getting this information from them. Okay, now your physical examination is focused. Again, you're going to be looking for telltale signs that may be part of an atypical presentation, along with the regularly assessment findings that you would include in a focused assessment for any age group. Again, you're going to be looking for agitation, any changes in cognition, and make sure you report your findings if you think there is an atypical presentation going on, or if there's not. But then again, if there is a typical presentation going on, you would definitely need to report that also. There's additional assessment methods, and again, these are instruments that you could use. And remember, for your social assessment in your assignment, it refers to the family APGAR, which is referred to in your textbook. And again, your cognitive affective assessment, again, your written assignment refers to one of these, but again, you can have your choice as to which one you would prefer to use. Again, if you determine there is an atypical presentation that exists, what do you need to do? Again, if you're in an acute care setting or a long-term care setting, these are the steps that you would need to do. Vital signs more frequently, keeping in mind that temperature may not be there, even though rampant infection could be setting in. Again, core or rectal temperature may be much more accurate than an oral temperature. Daily intake and output, weights may be required in cases of dehydration or fluid overload. Laboratory work, and observe for pain, function, and behavior. You just have to be a keen observer in this case. Whenever an atypical presentation is suspected, your clinical judgment will guide the interventions. Again, it could be a medical emergency such as a heart attack, and again, time is of the essence, and again, it has to be reported very quickly. Quick action, early diagnosis, and intervention and evaluation is key for the best possible health outcome.